Hi, I'm Dr. Elliot Goldberg. I'm here to discuss issues about attention deficit disorder, and a very common problem of kids who have attention deficit disorder is sleep problems. And I'm often asked, how do we address this? What do we do? Well, there are different one issue that seems to be very common is difficulty falling asleep. That could be due to the fact that there's poor limit setting, and just like he doesn't listen and doesn't follow directions, having to do with eating or cleaning up his room. I'm on the computer, 5 more minutes, I'll do it later. And so that's a very, very common thing. And the answer for that is setting up a good behavioral modification, having the parents set limits in a calm but firm way, and trying to reduce the stimulation, and especially about an hour or so before sleep, so that TV watching, computers, active games really shouldn't happen around a half hour to an hour before sleep, but instead more quiet time and kind of some ritual to let know that sleep is coming. It's called good sleep hygiene. TV in the room is known to interfere with sleep. It's also known to decrease reading scores. It's also known to lead to other problems. So if you have a TV in the room, the first step is to take it out of the room. The other thing is that very often kids simply are so inattentive, and their mind is always racing and talking and thinking about other things, and sometimes it's helpful to teach them some relaxation techniques, or they're very good at daydreaming, and teaching them actually how to daydream or pick one story, and then hopefully that will take them to sleep. Anxiety disorders are very common among kids with ADHD, and you need to diagnose that and address it, because it can manifest itself as difficulty falling asleep or having some worries about school, which is not a disorder, it's just normal. I have a test tomorrow, I'm not prepared, I didn't do my homework, blah, 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 and that needs to be addressed as well. Restless leg syndrome is a physiological disorder of sleep in which you get sudden movements of your leg and a need to move your legs, associated commonly with attention deficit disorder, very often treated simply by giving some iron. There are parasomnias, meaning that sleepwalking, sleep talking, which is really probably the easiest one to deal with, which is basically reassurance, because kids generally tend to grow out of that.